cops here. I need you to back away from the glass as much as you can. Cover your faces. Cover your face. I need everybody to stand up and walk. Everybody stand up and walk outside here. Walk outside here. Over to the curb. Walk over to the curb. How are you two doing? You look okay. I need you guys to stick around to help me, so just wait right here, okay? Are you able to walk at all? Get up and walk. Can you have hands up, but stay right there. I'm coming. Okay, I'm going to need one of your help. I repositioned this airway. I need you just to make sure his head stays in that position, okay? He's breathing on his own now. Just maintain that airway. Great. Okay, I'm going to need your help over here. Okay, she's bleeding pretty bad. I need you to hold pressure on that leg over there. Just put as much pressure as you can. I need you to stop the bleeding. You know your name? What happened? You know your name? You know what happened? Somebody. Help!
Get me out of here,
What's your name?
Jan.
Jan, do you know what happened, Jan?
The bus went over, I don't know.
Okay. You just stay right here. We got additional help coming, okay?
This firefighter has just triaged 15 injured people in less than 3 minutes. 9 people were categorized as minor injuries because they were able to walk away without help. It took less than 30 seconds each to assess, categorize, and tag the other 6. Respiration is the first assessment because it is the most critical function. If the patient is not breathing because of an obstructed airway, attempt to clear the airway. Depending on the type of obstruction, either reposition the patient's head or remove any debris that may be lodged in the throat. While repositioning an injured patient's head may be contrary to what you've learned about cervical stabilization, Dr. Greg Super explains how to handle a patient who's unconscious and not breathing.
If we do nothing, he's a certain field death. If we open his airway, we may aggravate an existing cervical spine fracture. We chose to make that intervention. If we open his airway, he makes attempts to breathe, and we can keep that airway open, he may have a chance to survive. If we leave the airway closed, he has no chance.
If respiration cannot be reestablished with these simple measures, don't waste time attempting CPR.
The first rescuer's basic instinct might be to begin CPR on the first one he encounters. That would be a mistake. These people die. If the first rescuer goes to CPR on the first victim he finds in full arrest, he will not be available to help those who still have a chance at living.
Non-breathing patients are considered non-salvageable and are categorized deceased. Move to the next patient.
Yeah, you need help over here. Need help support his head. Okay, just like this. Need you to help keep his airway open. Just like that, okay? Great. Don't let the airway close.
If the patient begins breathing after the airway has been cleared, categorize immediate and move to the next patient. To assess respiration on a patient who is breathing, observe the frequency of respirations. Patients who are breathing at a rate of more than 30 respirations per minute are categorized immediate and no further assessment is done. Move on to the next patient. Although you won't take time to actually count respirations, you can become skilled in visual assessment by watching others simulate rapid breathing. With practice, you will be able to easily differentiate between a person who is breathing faster than 30 respirations per minute and one who is breathing at a normal rate. If a patient is breathing slower than 30 respirations per minute, proceed to the next assessment, perfusion. Here's how the respiration assessment looks on the START flowchart. If the patient is not breathing, reposition the airway. If breathing does not resume, the patient is non-salvageable and is categorized deceased. If breathing resumes after you clear the airway, categorize the patient immediate. Patients who are breathing at a rate of more than 30 respirations per minute are categorized immediate and no further assessment is done. If the patient's respiration is slower than 30 respirations per minute, proceed to the second assessment, perfusion. In a multi-casualty setting, the capillary refill test is the fastest and most effective way to check perfusion or circulation. To do this, press down on the patient's nail bed and release the pressure. The skin underneath the nail should return to normal color within 2 seconds if perfusion is adequate. If it takes longer than 2 seconds, categorize immediate and move to the next patient. The radial pulse can also indicate perfusion status. If you cannot feel a pulse, the systolic blood pressure has probably fallen below 80. The patient's legs should be elevated to improve blood flow to the heart, lungs, and brain, and the patient categorized immediate.
Put as much pressure you can on there. I need you to stop her bleeding, okay?
In situations where a patient has severe external bleeding, direct the patient or a bystander to apply pressure to the wound. If the patient has adequate perfusion, proceed to the third assessment to check mental status. On the START flowchart, the perfusion assessment looks like this. Check capillary refill by pressing down on the patient's nail bed. If color does not return within 2 seconds, categorize the patient immediate. Elevate the legs and control bleeding if necessary. If the patient has adequate perfusion, the nail bed capillaries will refill within 2 seconds and you will proceed to the third and final assessment.
What's your name?
Brain injury accounts for half of the deaths in disasters. Patients with altered mental status are categorized immediate. You may have already observed the patient's mental status during the first 2 assessments. If the patient is unable to respond to simple questions or commands, categorize immediate.
My leg over here, my leg. Oh God, I think it's broken.
Just relax, just relax. Okay, you're breathing fine. You're breathing fine.
Get me out of here. Please, my leg really hurts. It really hurts.
Okay, you've got a good pulse. You've got a good, strong pulse. What's your name?
Jan.
Okay, Jan. What day is it?
Friday.
Friday. Good. Okay.
Please, it hurts. Oh God.
We're firemen are coming. Okay, we'll get you out of here as soon as possible.
Hurry.
All right, I've got help coming.
If the patient can follow simple commands, categorize delayed and move to the next patient. Here's the mental status assessment on the START flowchart. If the patient fails to respond to simple questions or commands, categorize immediate. If the patient can follow commands, categorize delayed and move to the next patient. The delayed category does not mean the patient is not injured and does not need treatment. It means the patient isn't at high risk of early death.